Great. Welcome, everyone. My name's Anna, and I'm from Osteo Kids Academy, which is a community of paediatric osteopaths from around the world who are interested in learning and growing together. Our guest today is Rebecca Baxter. Rebecca's been practicing in Brisbane since she graduated from RMIT in 2004. She began her career in a cranial practice with her husband, Scott, who's also an osteopath, and has treated babies from very early on. Over the years, she's done an enormous amount of professional development, all the biodynamic modules twice, and she has two boys who are 13 and 11. Her passion for paediatrics was further deepened after the birth of her first child in 2010, when she struggled with breastfeeding pain. That led her further into studying breastfeeding. As Rebecca's paediatric practice deepened, she began incorporating myofascial release. She's developed a keen interest in retained reflexes, and she's also explored some other interesting modalities that I had never heard of before. The reason I'm interviewing Rebecca is because many of us follow her on her social media. She's got Osteopathy for Babies pages on Facebook and on Instagram. If you haven't looked these up yet, you should. They're full of great content. Rebecca is also a seasoned presenter, and she's taught courses here in Australia on paediatrics and also on endometriosis. And she has another course coming up that we'll find out a bit more about today as well. Welcome, Rebecca.
Thank you.
What led you into becoming a paediatric osteopath?
I think mainly it's easier on your body, but I also really enjoy working with the babies or with the children because they're so full of health already. They're not stuck in a chronic pain pattern mostly, some of them, but not many. And you get to see results a lot quicker, I think, than when you get someone who's just had chronic back or neck pain for 10 years before they come to you. So I find it a lot more rewarding from a results point of view in terms of how fast you get to get someone well. But you also know you're making a big difference for someone for the rest of their life as well, particularly if you can get breastfeeding working. Their guts are going to work better for the rest of their life. And you're helping that mum have less likelihood of cancer of the breast for the rest of her life as well if she gets to breastfeed for longer. So some of those like extra parts of things are just really rewarding. Or if you've got a baby who's really upset all the time, that causes a lot of stress for the whole family. So when you get to treat that, it will also affect the rest of the family as well. So there's all the knock-on effects that I really enjoy being able to be part of as well.
Certainly helping a baby to be less unsettled and to feed well has such huge ramifications, doesn't it, for their whole family?
Yeah.
Yeah.
And the parents are at such a vulnerable time as well. I enjoy that level of care that you can bring emotionally for them without it being a psych consult. It's just nice to be that little bit of time where they don't have to be responsible for a little bit and they can calm down and everyone just like, oh, I feel sleepy now. And it's like, oh, it's because I've taken over and you're just having a relax now. So I really enjoy knowing that you're having that effect on the family as a whole as well. So
It's quite profound, isn't it?
mm.
And I often think if I can address a particularly gnarly little strain pattern in a child, obviously there's no good evidence to support, thinking that it's going to make a big influence, but I strongly think that it does. And
Absolutely.
yeah, it's nice to think that you might be saving that person in adulthood from a whole range of aches and pains and early arthritic change and all sorts of things like that.
Yeah.
What percentage of your practice is pediatrics?
Currently, I'm probably on a day-to-day basis would be between 70 and 90%.
Yep.
So, and some days it will be all babies and maybe 2 or 3 older children as well. So it just depends. But yeah, I do still have some older adult patients who I've been seeing for years. So they still come in and see me. But also I would get some new pregnant women. That would be my other new patient that I would see as well. So I do get some adults who are new patients too.
Yep.
So.
Yep. sometimes not quite as fun, but the conversation's often a
Oh
bit.
no, I love it. I just, my job, I love my job. I feel like I don't want to ever retire. Like I want to be like Anne Wales and just keep teaching and, like, yeah, and just keep going. I think it will be amazing. So
I know. If only we could bottle the love of the job that we have and show it to these new grads that
yes.
finish osteo and then go and work for a pharmaceutical company or something.
Yes, yes. How did they get through the degree if that's what they end up? Yeah, it's
I
such
know. Yeah,
a
it's
shame.
a tragedy, but anyway, that's for another conversation probably.
Absolutely. So many things to be said.
Um, so tell us more about all the different things. Every now and then on social media, I'll see you talking about a modality that's external to osteopathy that you've
Mhm.
brought into your practice. Tell me a bit about those things and some of the things that have influenced you the most.
Yeah, so I found like I started off with cranial probably for the first 15 years. I was just everyone was only doing cranial in our practice. And then I kind of got itchy feet, I guess. I just felt there were some presentations I wasn't really getting to the core of what I wanted to achieve for that patient. So I started looking elsewhere. Like I started just popping a little bit of myofascial in. The first part was going in and doing some Baral courses, which I found just excellent. I was really impressed with their specificity and their ability to have a really quite a profound shift. It really, I do feel that when you're working myofascially, it allows the body to have much more of a nervous system shift in terms of like the cerebellum having a much more awareness of that space and being able to control it better. So you get a better sensory input and better motor output when you're working with myofascia. Whereas cranial, I tend to find more that we're getting that cellular, intracellular signaling happening better and a better general health happening in the general area. And then able to be like all the electric polarities working more in line with each other so that all of those cells can work together. So I think you're getting such a different reaction. And so as I started to do that, I started to become a little bit interested in cerebral palsy as well. And I started following some OTs from the States and just watching some of them. So Cuevas-Medec is something that OTs in the States use a bit. And that's created down in South America by Raymond Cuevas-Medec. And so that one's all about positioning someone so that then they have to use the muscle that's not firing well. And it just makes sense to add that in while you're still doing a bit of cranial or a bit of myofascial release to add in some of those extra movements to help the body to be aware of themselves in gravity, essentially. And all of the cerebral palsy people really talk about head riding reflex and being able to get head control, neck control, trunk control happening. And that, again, it makes sense when you're looking at a breastfeeding baby. If they've got very poor head control, they've also got very poor jaw and tongue control because they're working so hard to get their trunk and their head stable to then be able to use the mouth as well. So it just made sense to work into that type of thing too. And then I looked into reflexes as well, all the retained reflexes stuff. Jamie Taylor's course was fantastic online. I highly recommend anyone to do that. But then I got curious. And so I started looking into more and I just read a whole heap of books. Again, looked into some OTs in the States because OTs in Australia don't seem to do reflexes. They're quite a different modality to what an OT in the States is. A bit like osteopaths in Australia versus some of the osteopaths in the States. So that's been an interesting observation to see too. But yeah, the retained reflexes stuff, you can really see once you start looking really hard into it, like even in adults, there's so many of us who have like a retained Babinski problem. It's not fully retained, but there will be difference in sensation on both of the feet. So if you do them bilaterally, people can feel a difference. And cranially, I can notice a difference with how things are being perceived by the nervous system while you're working with that. So that has been really interesting to work with. And there's some wonderful OTs in the States who are working with babies doing reflexes and getting them to be expressed properly when they're supposed to be there still. Because again, that makes sense too. Like if we're going to have a retained reflex, or why did it retain? It's probably because it wasn't being used very well when it was meant to be used. And so then that pathway wasn't really myelinated properly. So I've gone down a big road with that, looking into that type of thing too. So it's been really good. Yeah, all those bits.
Yeah.
Yeah.
Yeah. Well, I mean, cerebral palsy is a fascinating one for osteos, I think. We've been having a bit of a play around with the Hind, which is like an assessment tool, and
Yes.
so many of the assessments within it, I think, are things that osteopaths could improve. And
Yeah.
so I'd love to have a bit of a play around and do a before and after Hind on some of these babies and actually see how much of a change manual therapy could provide.
Yeah. It
I
would
don't know.
allow us to create better research if we were able to use those tools to
Mm,
speak about things that other people are interested in, how they shifted. So, like, obviously, I'm always interested in how the patient feels to my hands. I'm interested in how the patient says they're feeling or
mhm.
is behaving for the baby. But yeah, obviously, some outcomes that we can measure would make for great research, which would then help our profession be more widely known and more widely accepted, which I think is really important. So,
Absolutely. Absolutely. One of the things I've been really blown away by in the last sort of 12 months is understanding really the scope of practice of osteopaths, and I'm discussing osteopathy in Australia, really. It might be different around the world, but to understand that a lot of what physiotherapy and OT do here are for children who have a diagnosis, who have a disability. And a lot of what we do as osteopaths is for children who don't have a diagnosis, but have all this musculoskeletal tightness and asymmetry. And it's such a shame, really, that we can't do more for a lot of those kids that desperately could benefit from it as well.
yeah,
So it would be interesting to see, down the track with a bit more research on things, whether we could become more useful to kids with things like cerebral palsy and actually really become more embedded in the NDIS, which is our disability insurance program here in Australia that support children with disabilities. Um, but yeah, that's really interesting and incredibly valuable work that you're doing with that. Would you say that's one of the things that you love treating the most, or have you got like a few things that when you see them booked in, you're like, yes, woohoo?
breastfeeding challenges for sure.
Oh yeah.
Um, they're really rewarding to work with
Mm,
because you're definitely getting a change for mum as well. Because they're often very emotionally attached to breastfeeding and they may be in pain also. So that's a huge one.
mm,
And I really enjoy seeing more complex ones, like the cerebral palsy child or a child with quite low strength, but it's not cerebral palsy, but then you can see they've got things that look like cerebral palsy. And so that's where when you start watching these people treating these children who have quite big symptoms with cerebral palsy, it becomes
mm,
more obvious, this child has a little bit of that presentation. And then you can work with them to just really strengthen up the awareness of their body so that then they can get that pathway working properly for themselves and there's not going to be any long lasting problems.
mm,
Because I think most of the kids, well, all of the kids really, who come into us without a diagnosis really don't need to end up with one either.
mm,
But you can definitely see that there's some slow parts to their neurological development as they go along, if you can look out for them. And yeah, then I'll get the parents to be doing a little bit of work with proprioception as well, in any areas that I would notice as well. So yeah, that's really rewarding knowing that they're going to have better coordination, and all that kind of thing too.
yeah,
They're probably my favorite. Yeah,
mm,
and I had another one that I really enjoyed. I had a kid with hydrocephalus, and
yeah.
he was quite pronounced. He'd already had a shunt placed in. So even just being able to feel what the shunt felt like in his body and all of that stuff was fascinating because we don't get to see a lot of post-surgical children, even though I think we would be exceptionally helpful for them. But also then going back and going, okay, so from a musculoskeletal point of view, like what would be a big part for this. And then, yeah, really getting into the parietals and how much they're helping with the folks and getting all of that movement of the cerebral spinal fluid through that space working properly. And he did really well. He'd had quite a bit of neurological regression after his surgery, which was obviously quite distressing for the parents. But yeah, we got him up and walking and all that kind of thing, which was really exciting. So I really enjoy that. Or delayed milestones as well, just generally. I really enjoy working with crawling and walking and all that kind of thing too. So
Yeah. I had a baby the other day who had delayed milestones, and the mum came in and she said, she's hitting all her milestones except for her gross motor, and she just didn't have she wasn't rolling basically, and she was about 8 months old. So there was some red flags going on, but she was as stiff as a board. And I said to the mum, look, I think you should continue to go along the path that she was heading onto, which was she had a pediatrician referral lined up and all that sort of stuff. But I said, look, let's just give this child a couple of good loosen ups, honestly. And that's all it took.
yeah,
And that was one of those things where, I mean, this happens all the time, but it's a very simple fix that very, very few, there's very few opportunities for a child to actually have some good quality musculoskeletal manual therapy,
yeah,
to just actually get in and get them moving and loosened up and working well. And it's
yeah,
really not rocket science. Like it was a lot of GOT and
yeah,
harmonics and, a little bit of myofascial release,
yeah.
and off they went.
Nice.
Yeah, it's pretty cool, isn't it?
It's really awesome. And I think too, having looked into with the Empire method, particularly from the States, they talk a lot about like compression, adding some input to the nervous system and distraction being able to calm the nervous system as well. So she even talks about dopamine being created when you're putting compression in, which I was like, well, that'll be interesting when I see my ADHD kids as well. But even just for the early part of development, like just giving the parents that potential to give a little bit of compression into the joints. But for me, adding that compression as part of when I'm doing my cranial work as well and feeling the difference that it makes with the nervous system response to is really quite awesome as well. Like we have so much scope if we just allow ourselves to think bigger than where we've started as well. You can just explore and keep exploring. And I think that's what I really love about what we do is we can keep changing what we're doing and finding better ways of doing it all the time.
So cool. Imagine what we'll be doing in another 20 years,
I
Rebecca.
know, like things change all the time. It's cool. We can have another discussion.
Um, so do you have particular go-to techniques that you would highly recommend that we go away and learn how to do? Like when you think about it,
Yeah,
day practice?
I like I started with cranial, so I really
Mm,
do. It is my canary in the coal mine.
mhm,
Like I'm always monitoring cranially anyway. And I tend to I train in the biodynamic field, so the bit that I use the most is wholeness, where I'm thinking about one part affecting another, essentially, which really comes back to our principles anyways, osteopaths, regardless of what technique you use. But yeah, constantly I'm always monitoring to see what I'm doing down here is affecting up here and all that kind of thing as well. So that's just an always thing. But I think that's just because that's where I started as well. But yeah, articulation has been another one that I'm adding in for sure.
yeah.
Quite a lot. I've really liked that. I'm using a lot of myofascial as well.
Yeah.
But yeah, and a little bit of harmonics too, which I haven't been taught, but I can just tell I'm using it. Because again, when you start looking into some of the retained reflexes work, they'll be looking into rhythmic movement, and that is stimulating the cerebellum. And a lot of the time, we're just needing to add that little bit of rhythmic, and you're feeling for what speed that rhythm needs to be to get the
Mm,
best response from the nervous system while you're working it as well. So yeah, that will just naturally come in anyway as well. So it's really is a mixture. And I think it just depends on the presentation of the patient too, like when they come in, what their system feels like and what feels like it's working the best to get the best response at that moment too.
That's interesting. Yeah, I've never learned those harmonics either, and yet they just come naturally
Makes
sometimes.
sense,
Yeah,
doesn't
you're
it?
following the tissues and they
Yeah,
just want to move. They want to
yeah,
move.
definitely.
Yeah. When I lived in Dublin, I met a few people from that were trained overseas over in Europe, and I think it's part of their training over there significantly more than it is in Australia.
Nice
Mm.
one. I noticed because we have a lot of SU graduates up here, they talked about some people who had come across from Europe.
Mm.
I'm not sure which school it was, but there was an Italian person, and apparently they start with indirect. They don't start with the direct techniques when they start learning. So that was fascinating to hear as well, that we've got these different ways of teaching over the world as well. So
Interesting. Very interesting. So with Osteo Kids Academy, one of the goals of building the community is to help early career pediatric osteopaths, people who are looking to get into peds, and encouraging them, because in Australia in particular, it's quite difficult. It's quite a difficult pathway. There's not a very clear path forward unless you're working in a pediatric clinic. Uh, what advice do you have for somebody who's just starting out in their career? What advice would you give them?
I think you need to have good patient handling skills because you look far more confident if you don't look nervous picking up a baby. Like you need to be able to move that baby around, and it will make you feel more confident. So I highly recommend holding other people's babies for starts, like go and see all your friends and your relatives and hold their babies and get used to what it's like to hold a baby while they're squirming around. And go and play with your kids' friends and your family's friends, baby children, sorry, because then you get used to how to speak to a child. Not every child wants you to look at them. Not every child wants you to engage with them directly. Like, get used to the fact that you're going to have to change things a little bit with your communication with a child because they're not an adult. And I think that helps just you feel comfortable when they actually walk in the room first. In terms of trying to build up the amount of them coming in, one of the best things I did was actually sending through to all of the local midwives and lactation consultants a little video of me and how I treat mastitis. And I offered to come and teach them how to do it as well, because it was just a nice way for me to say, hey, I exist and I've got things that will help you as well, rather than saying, hey, I exist, can you send me people? So that was really helpful. I think also anytime you see a kid, it's really, if you're trying to build your practice, it's really important to write a letter back to the GP that they see, even if they didn't send them in, or the lactation consultant or the midwife. Even if they didn't send them in, you can say, this patient presented, we have both treated them, and I just wanted to let you know what I've been working with for them, and just updating with them with how they're progressing with whatever they've been seeing that other person for. I think that's really useful. And then if someone does refer to you, always write back to them because people appreciate it. It doesn't have to be long, and just set up your regular template to help you do it quickly if you need to. But that is something that will really help grow your practice, I think. In terms of feeling confident while you're actually working on them, I think people should focus on what they're good at, basically, and get really good at what they're good at, and then go out to other things. So if the local person near you who does peds does a thing that you're not great at, don't try and be like them. Like, be yourself, find the bit that you're good at, because then you're going to exude confidence when those people walk in your door and you're actually going, okay, well, this is what I'm going to do. Yeah, I think that's really important, not to try and just emulate someone else. Like, learn from them and pick the bits that work really well for you, and come back to the stuff that didn't work well for you later, because there will be gems in there that you've written down and go, oh, I wrote that down like 5 years ago and I was not ready for that information at that moment in time. But yeah, like, yeah, don't try and emulate someone else. Try and be yourself and really stick with what feels right for you as you're going along, I think is really important. So,
That's good advice. It's interesting to me actually, that fewer professionals write letters than you think.
yeah,
And so like there's some great allied health practitioners here in Canberra that very rarely write letters back. And they still get lots of referrals, but you're just like, wow. So it really does make you stand out when you make the effort. No.
absolutely. It's not something I did a lot when I was first starting.
Mm,
Um, but it's definitely something that has helped me get busier. So I could
mm,
definitely recommend it as something that will
mm,
help anyone get busier. Even if you're trying to not see peds, like whoever you're seeing, if you just
mm,
make your practice busier generally,
mm,
it's
mm.
worth doing, I think.
Sure.
Particularly if it's a type of patient you like, like encourage the type of patient that you like,
Yeah.
is helpful too. And getting on social media and doing little videos of yourself as well, like it's so useful to introduce you as a person and what you're like as a person on a little video for someone to kind of vaguely interview you, kind of almost on social media, and see if they would be a good fit with you and whether they want to listen to more about what you're going to say. And I do a lot of work with my socials as well for our workspace. I
Mhm.
try and give as much information to patients about, like, or prospective patients even, about
Mm,
what kind of exercises their kids are going to be doing, like what they
mm.
can do with their kids at home, or just any kind of useful information. Like, try and make your socials useful rather than, here I am, I can treat you. Like,
Yeah. Yeah.
that's just going to be the same as everyone else, and why would they come and see you? So
Yeah. 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 No, I think you're absolutely right. We had a look once at who was booking online versus who was calling our business. And what we found was that a lot of first-time parents called us and
yeah,
wanted to
interesting.
talk to someone before
Yeah,
they just booked randomly online.
yeah,
And that was really interesting. And I suppose it makes a lot of sense if you're going to see, I don't know about your clinic, but I would say the majority of people who bring their baby in to see us have never seen an osteopath before, possibly even
absolutely.
heard of one, right?
Yeah,
So they turn up with this, this precious baby, and the trust that they have to show up and hand their child over
yeah,
to this stranger. An if you can make that barrier as small as possible, and for them to feel like they know where you are, where they're going to park, that you've got nappies to change facilities, that there's that they're going to be welcome to breastfeed, what it's going to look like inside, like all those things break down that cognitive barrier that they have of what is this going to be like.
yeah. Particularly when you've got people who are worried that you're going to manipulate your baby. Like, that's a big barrier, absolutely, that I face. Or like pediatricians telling them not to see us as well, which is another barrier that I definitely have up here.
Yeah.
Um, People that, like, this pediatrician, not even specifically don't see me, like it's don't go and see an osteopath or a chiro or anything other than a physio, or even sometimes not even a physio. So like, yeah, it can be very difficult when you've got someone who is quite high standing in your prospective patient's eyes saying something like that to them. They're like, oh, this could be really dangerous. So another thing I do, like when I have got a new patient coming in, particularly if they look nervous, but I do try and do it anyway, I
Mm,
say what I'm doing as I'm doing it as
mhm,
well,
mhm,
particularly because the parents can't feel it. I'm saying, okay, I'm just making gentle pressure onto this or that part of the body. This looks really normal. That looks really good. And little things like that can make parents feel good. Like, okay, I'm testing this. This looks really normal. Oh, this one's not moving quite so well. Can you see that as well? And just showing them the bits that aren't moving so easily can really help them on board better with,
mhm.
yes, we need to treat this because that's not symmetrical. So yeah, I think that's really helpful too, just to get used to speaking to the parents quite well.
That is also excellent advice, because often I've actually had a few patients over the years who've seen other practitioners who haven't done that. and often they don't know what's
Yeah.
happened, and they come away really confused, particularly if there's not like some sort of amazing change. But even sometimes if there is, they're just
Yep.
like, it was
And
great,
they
but I
don't go back.
I had
Yeah.
no idea what they did.
Yep.
And I think it's difficult for some practitioners. Like I find I work better with my eyes shut. And so that's something I have to explain to the parents. Like, okay, I'm
Yeah.
going to concentrate for a bit. These movements are really small. So I'm not falling asleep. I'm just going to be concentrating with my eyes closed, but ask
Yeah.
me lots of questions and I'm still chatting away.
Yeah. Nice
But
one.
we all have our quirks, right? And
Absolutely.
yeah, you just have to, like you were saying, you have to find what works for you in this space.
Yeah.
And one of the ways I described it is like we're all different flavors of ice cream, and not everybody likes chocolate. But if you follow the principles and you are confident with the techniques that you choose, then you're going to be effective.
Yeah.
We are all a bit different, and that's a good thing.
Exactly. Well, it means you're going to work well for someone that someone else doesn't work for
Yeah,
as well. Like
yeah,
it's
yeah.
yeah, it's important.
Uh, what's the most rewarding thing about being a pediatric osteopath to you? Like, do you ever
Mm.
skip home after work, like
I talk shop all the time.
on a high?
I went and caught up with an LC today, and she came back and texted me later and said, "I'm sorry, we just talked about work the whole time." I'm like, that was good for me. I liked that. Yeah, I just knowing that these kids are really going to have a change in their life, I think that's going to be a lasting change too. Because if you can get someone to coordinate properly, they're going to be more confident in sports. So they're going
Mm,
to have a happier schooling experience from a sporting point of view. Or if you can get their fine motor control working better, or even their trunk control working better, they're going to be able to write and read better. Like all of that kind of stuff. Like you're having these knock-on effects where it's bigger and so much more than just that moment in time where you're with them. And
mm,
even educating the parents about something that will help their child too, knowing that that's going to have that knock-on effect of growing that nerve pathway and allowing that child to really be better at the bit that's not working so well at that time. Like it's
mhm.
yeah, I love it. Like
Potential, the potential that
yeah,
you're investing with them becoming
absolutely.
their full self and their reaching their potential in their
Yeah.
life.
Yeah,
Yeah.
I think you still can get that a bit with adult practice.
Mhm,
Um, it's just that it takes a bit longer sometimes. Like not every time, obviously. Some patients are pretty quick, but yeah, like I think I would be very bored if I was just seeing that same loop of patients who book in every month and booked out for 6 weeks in advance. Like I don't want to see the same patients all the time. I think that would be I would be bored because I
mhm,
would feel like I'm kind of doing the same thing all the time, or I would be stressed because I'd be trying to do something else to help them improve as
mhm,
well. So,
mhm.
yeah,
The thing as well as that, which is so having a meaningful job, I think is quite rare sometimes,
yeah,
particularly in Canberra. We have a lot of public servants here that, contrary to popular belief, a lot of them work incredibly hard, but finding meaning in their work is sometimes a bit of a challenge.
yes,
So I feel so grateful that we have this meaningful path.
yeah,
Um, but one of the other things about treating babies for me is just how much fun it is.
mm,
And, playing with toys and getting them to laugh and making it a really enjoyable experience
yeah,
is also great. Like I think I probably laugh more during my average sort of consulting day, than the average person. And
yeah,
it really is a very enjoyable hanging out with kids. I
yeah.
find it really fun too. Um, so tell us about the courses that you run.
So at the moment, I've got one coming up for 0 to 3 month olds.
Mhm.
So breastfeeding, torticollis, like all your common presentations in that early period.
Yep.
So yes, I'll be working through the reflexes for that, and my fascial releases for that, and cranial work for that as well.
Yep.
And then the other one that I do as well is a 0 to 18 month, so milestones, and getting kids to help getting through on their milestones with that one. That there's some slightly different things because I teach more about like transitions and getting kids to be comfortable to transition from sitting to lying down, or all that kind of thing, basically, or sitting to standing and that kind of thing too. And getting 4-point crawl going and getting them to do cross midline activities and getting all the reflexes going. But yeah, I'm working on creating a course for people to come to that'll be reflexes for any age group as well, so that then it's applicable to any patient that you see.
Yeah.
So that's,
Nice.
yeah, it's been really nice, because you can imagine, like, ATNR is a really good one to highlight this.
Mhm.
If you've still got a bit of retained ATNR, you're going to have a little bit of rotation in the neck, which is going to throw off all of your visual tracking problems.
Mhm.
You're going to end up with a little bit of tension down the other side of your spine,
Mhm.
because that's naturally going to happen, which is going to throw off your coordination with your legs. So you're going to end up with pains from that, basically, let alone coordination issues, potentially headaches because your eyes aren't working together well. So it really has knock-on effects for everything. And like with Babinski, if that's not working properly, you're going to end up with flat feet. You're going to end up with knee problems from that. A lot of people will end up with, like, I find, having problems with the sensory nerves not really working very well into the sacrum and into the lumbar plexus. And
Mhm.
so then the information's more traveling up through the sympathetics or the vagus, and that's creating problems for them with all of their pelvic organs and so on as well. So it's just such a wide-ranging thing. It's not going to just affect babies or just affect children. Like, certainly there's all aspects of these things that can cause problems for people, even if they haven't realized that it's retained as well. So,
Yeah. Fascinating.
yeah,
So,
it's pretty cool.
so the 0 to 3 month course is coming up soon. When is it
Yes.
exactly?
So that's 8th, 9th, 10th of October. I'm pretty sure I'm getting the dates right.
Oh,
Sorry.
good.
It's on the Saturday, Sunday. I'm heading down on the Friday. So I had to take the day off.
That,
But yeah,
yeah, very soon.
yes, very soon. Not this weekend, next weekend. So yeah.
Better
So
get this out ASAP. And it's in Melbourne, did you say?
yes, we're hosting at High Street Holistic this time. So be nice.
Lucky Melbourne.
Yeah. They have too many down there at the moment. There's a wealth of choice for them all.
And if people want to do your course coming up, how do they access it? How do they book
Yeah,
in?
so Facebook is probably the easiest. Any of the CPD Facebook forums,
Mhm.
and also the pediatric Facebook forums, and then my Osteopathy for Babies one as well, all have the advertisement there. So
On it.
yeah,
Awesome.
it's through a try booking link. So
Okay. And when are you doing your infant milestones and reflexes
yeah,
course?
so I'll do one next year.
Mhm.
I'll probably do it up here and potentially down in Melbourne as well. We'll just see. But yeah, that one I'll host in Brisbane next time.
Yep.
But also had a little bit of interest from South Australia, so potentially come down to Adelaide. Like, I'm
Sick.
open to going to different places. It's just got to be enough people to make it worth it. So um, yeah,
Oh, hats off to you. I'm sure organizing a course, like just the
a
sheer
lot of
amount
work.
of work is involved, let alone actually doing it and organizing the
Yeah.
venue and everything. Amazing.
But
Yeah.
it's good. Again, rewarding, because you know you're going to be affecting a whole heap of more patients, because more practitioners are then being more confident to treat more people. So it again has that meaningful part, which is pretty awesome. So
Mhm. Fantastic. Oh, thank you so much. What an interesting conversation.
thank you. It's been lovely.
All right. Well, we'll wrap it up there. And the last thing is that Rebecca's actually prepared a couple of, I suppose, resources that she's providing to the community after this webinar. So they'll be attached underneath this presentation. And thank you so much, Rebecca, for that and for your time tonight.
No worries. Thank you. It's been lovely.
Right. Thank you so much. We'll talk to you soon.
See you.
Bye.
Now say okay, because I think I need to. There you go.